So welcome everyone to this e-poster, Making the Right Choice, Teaching GP Registrars About the Rational Use of Tests. My name's Simon Morgan. I'm a GP and a medical educator, and I'm coming to you today from the lands of the Awabakal people in Newcastle. And it's a great pleasure and indeed a passion of mine to be able to talk about this topic, and in particular in this e-poster to describe one general practice training providers, that is GP Synergy's, approach to teaching registrars about the rational use of tests, including the incorporation of choosing wisely recommendations. So a little bit of background. We know that pathology, imaging and other tests have an essential role in the diagnosis, monitoring and screening for disease in modern practice. That's apparent and clear. However, we also know that over-testing is an emerging problem and is a significant issue for patients and for doctors in the health system. There's an example of that here. This is an MRI of a meat pie, so I'll allow you to think whether that's true over-testing. Over-testing is especially problematic in general practice where we know there's a low pre-test probability of serious disease. And data from Australian general practice would suggest that pathology testing is frequently inconsistent with best practice or clinical guidelines. The other aspect to this is that vocational GP training is really a critical part of the development of future patterns of practice for doctors, including test ordering behaviour. So it makes a lot of sense to get in and use an intervention like this at this critical venture in their training. So as part of the external educational release program for GP trainees, we run a session, a 90-minute session on the rational use of tests. These are the learning objectives, which I won't go through in detail, except to highlight the fact we talk about the influences on test ordering behaviour, the potential harms, and indeed significant harm to patients, practical applications of how they can apply these strategies to use of tests in their practice. We talk about prevention and screening programs, and importantly, how these apply to our Aboriginal and Torres Strait Islander patients. And there's a whole range of strategies that we use in the way we teach it through clinical scenarios and vignettes. And highlighting these, the importance of a good clinical assessment, access to appropriate guidelines and specialists, including the choosing wisely recommendations, but really critically sharing decisions with patients around whether to test or not. So this has been a hugely successful educational intervention for our registrars, with clear implications for better practice and cost savings, but also one which we believe can be adapted to other settings, both GP registrars in other areas and other health professionals. So thanks very much.